This is my 6,000 video on Othered. My reflection with my own personal experience was I was an EMT in a larger city, and we had this call to a homeless woman. She was being treated for sepsis, and she left AMA from the hospital. So we picked her up, we took her vitals, and she had a super low blood pressure, and she was tachycardic. She was a little altered and kind of confused, and she was a known drug user, and she was African American. She left AMA because she was a heroin user and she couldn't handle the withdrawals. After reading Cross Curry's article and how these biases affect othering behavior, I've seen it often with what we call frequent flyers. They will be passed because they usually come in with the same problems, and the RN charge deems it not an emergency. This is a big discrepancy because there may be something other than their chronic condition affecting their body systems, and it's important to treat serious symptoms with high quality care despite how frequently they are at the hospital, or the color of skin, or the way that they're presenting or dressed. Do people in this group experience equal care who are not in this group? Absolutely not. If a person who did not have this occupation presented in an unclean way wasn't Black or female, I highly doubt that the nurses or the physicians would have let the patient in my earlier example leave so briefly AMA. I think they would have provided a lot more education on what sepsis can turn into and how it could lead to death if she does choose to leave. The effects on an individual in this group, to the group as a whole, and to healthcare providers. It's difficult, especially when you're a newer nurse or a younger nurse, to stand up to more senior nurses or physicians who dismiss vulnerable populations in the hospital setting. When you see something, you should say something. And if your immediate supervisor isn't listening to you about it, then you need to climb that hierarchy or those supervisor positions until the patient that you are caring for is getting the adequate care that they deserve as their human right. If I could change the healthcare system and educate physicians or APNs, I would provide them information or education on why people do sex work, and that high-risk lifestyle does not mean low priority. Also, at many times, it may not be their personal choice to be affiliated or have an occupation of sex work. Persons may be involved with sex work and turn to drug use to cope with the stressors of being a sex worker, or they may also be forced to use drugs to continue to be involved in sex work. I would just like to educate physicians and other clinicians about particular locations or populations surrounded by a hospital so that they can understand what these people are going through on a day-to-day basis and why they are struggling with these comorbidities and poverty, and that it is not many times their choice to be suffering from these conditions or these living situations or occupations.